Let me jump to another topic. All within this concept that I labeled the sanctity of life. Here you have one of the true tragedies that are happening in medicine today. Tragedy because the doctors want to do well, and they're doing evil. Brainstem death is recognized as halachic death. Brainstem death means no circulation reaches the brain, for whatever reason it is. Usually because he went through a windshield. The brain swelled, the pressure in the skull was greater than his blood pressure, so blood couldn't get into the brain for a length of time. The brain dies like all other parts of the body. If you cut off the circulation, the part dies. But we can keep him in an organ system. His organs can stay alive. How? By putting him on a ventilator, by giving him food, by giving him whatever care he needs. Keep him going, sometimes for several weeks. And during which time the brain isn't there at all. In fact, during which time, if it comes to autopsy, you'll find that the brain sometimes doesn't exist. It's an empty skull. The brain has been digested by the body. Because like all parts of the body that die, the body has an ability, but the circulation of the rest of the body was kept intact. What they've now decided to do, that's the next step. They went ahead and they decided that since the family asked them to stop treatment, they will go ahead and not wait for the brain to die. They're going to wait for the heart to stop. As soon as the heart stops, everything is prepared. The recipient, the donor, are lying in the surgical theater. They take out the heart from the cardiac death patient because the heart stops. For how long? For 70 seconds is the rule today. They put it into the chest of the recipient and they shock it into life. So here's this Talmudic logic. This fella died because his heart stopped. And the patient's family don't want him resuscitated. No resuscitation. So he's dead. I take the heart out, give it to someone else, and I shock it back to life. Question is, was the first fella dead or not? Did his heart really stop? If it stopped for 70 seconds and I could shock it back to life, he's not yet stopped. The heart stops in between beats also. This is what they're trying to substitute for brain death, because brain death takes too long. Therefore, you have here a strange situation. The doctors always want to do good. They want to help. There's a poor fellow who needs a heart. This fellow is going to die, if not today is tomorrow. What they said was, because his quality of life doesn't exist anymore, therefore he is dead already. That's a new development. And it's in existence in all hospitals today, including Canada. What happened now?
I think it's when you click the middle button, it goes to, when you click the middle, it goes to this little thing.
Which one?
You're fine. Just don't click the middle, don't touch the big
This
button.
one?
Don't touch that.
Don't touch the big one?
No.
That was going the wrong way. Okay. Just sum that. You read that yourself. That's a protest in New England Journal of Medicine against what has now become practice, a 75-second asystole, meaning if the heart stopping for 75 seconds is enough to declare the patient dead. About a year and a half ago already, Rabbi Shalom knows him, I'm sure, Avram Steinberg. Avram Steinberg, who's a fine Talmud Chacham and head of neurology He's a pediatric neurologist, the head of neurology at Shai Tzedek Hospital, and head of medical ethics at Hadassah Hospital. He did a fabulous bit of work to convince the Knesset to pass a rule. The rule is that we put anyone on a ventilator with a Shabbos clock on it. And the doctor writes a prescription, like he would for any medicine, 24 hours of ventilation. After 24 hours, the clock turns the machine off. If he wants to keep it longer, you have to go reset the machine. What he tried to do, and incurred the wrath of the religious community in Israel, to differentiate between cessation of therapy and instituting new therapy. We never stop therapy that's keeping the person alive. As I said before, but if a new situation develops, you need to respond if the quality of life isn't there. So he wants to, by putting a Shabbos clock on the ventilator, then every time the clock turns off, my question is, should I now institute a new therapy? Should I put him on a ventilator? Because the ventilator was set only for 24 hours. He got the Knesset to pass a bill. That's the legal status in America, in Israel today. And of course, he incurred the wrath, right, in which they called the new support is murder. What's accepted today meaning this year, pretty much, it made it, in fact, every article you read in medical ethics recognizes that futile care should not be given. You know, who decides what's futile? What's called futile care? If you see some of the stuff that Obama, no friend of humanity, what he put into his new health bill, basically to stop treatment for chronic diseases, to provide only supportive therapy for chronic diseases. Because it's futile. You're not going to accomplish. So the fellow will live another year or two. So what's the big deal? You know, strange community, this community of do-gooders. If a fellow would climb one of your mountains here and get lost on the mountain because the idiot shouldn't have been there to begin with, then you have the Air Force and the Marines, and everyone go looking for him, might spend $2 million overnight to try to rescue him. But a sick old man, a sick old woman, it'll cost too much money to keep him alive. There's a fellow whom I visit 3 times a year in Eretz Yisrael by the name of Rachamim. His original name was Professor Malamed, a well-known educator in Israel. He came down with Lou Gehrig's disease, some variant of Lou Gehrig's. It's now close to 20 years, 18 years or so that he's immobilized. The only thing he can move is his eyes. He cannot move any other part of his body, not a finger, not a foot, nothing. Keep such a fellow alive is futile. Okay? Look what this man has done. When I come to visit, by the way, we discuss, he types out by moving his eyes, we discuss the Gemara of the day, the Daf Yomi. We discuss the next Parsha that we read in the Shul. And he's a gifted artist. Watch what this man has done. Just moving his eyes, nothing else. Lies there with restraint, shouldn't fall out. Such an existence is futile. What's the purpose of such a man living? So here you get the halachic statement. Futility is determined only by the patient, by nobody else.